If you're sexually active, it's important to get tested for STIs regularly. Getting tested not only allows for diagnosis and treatment of STIs, it also allows you to make informed decisions with your partners about STI risk and prevention, and helps you protect your partners from STIs. At Campus Health, there are two types of testing offered, GYT and STI testing. GYT, which stands for Get Yourself Tested, is the free STI screening service offered at the Uptown Student Health Center. GYT screening tests for 3 STIs, HIV, gonorrhea, and chlamydia. Unlike STI testing, GYT is only available to students who are not exhibiting any symptoms of STIs and who have had no recent exposure to STIs. GYT is confidential and does not get processed through health insurance. STI testing at the health center is available to any student regardless of STI exposure or symptoms. STI testing can also test for a wider range of STIs than GYT, including HIV, gonorrhea, chlamydia, genital herpes, syphilis, trichomoniasis, and HPV. STI testing may be more appropriate than GYT in a few situations. If you're sexually active, the CDC recommends STI testing at least once a year, regardless of STI exposure or symptoms. If you've had unprotected sex, if you have a new partner, if a partner tests positive for an STI, or if you suspect you may have been exposed to an STI for any other reason, STI testing is recommended as well. If you've experienced sexual violence or sexual assault, it is recommended to get STI testing. If you're experiencing symptoms of an STI, such as rash, sores, bumps, itching, burning, pain, odor, discharge, and/or bleeding in your genital area, getting STI testing is recommended. It's important to note that STI testing at the health center is charged through your health insurance, and out-of-pocket costs for testing will depend on your insurance. Many students worry that their parents may find out if they get STI testing. Here's what you should know about confidentiality and STI testing at the health center. GYT testing is confidential and is not processed through insurance, and you will be notified only through a secure message in the Tulane patient portal and/or by phone call. For STI testing, confidentiality is more complicated. If you are covered through TSHIP, Tulane's student insurance plan, all billing information should go directly to you, unless your parent's address is the default address for TSHIP. You can check or change your TSHIP address in the patient portal. If you are covered under your parent's insurance, an explanation of benefits letter sent to them may list that STI tests were performed. However, in this case, it is difficult to predict how much information will be shared with your parents. If you would like comprehensive STI testing but do not want to go through insurance, you can pay out of pocket for STI testing at a community provider in New Orleans. Two providers that offer low-cost STI testing are Planned Parenthood New Orleans and Crescent Care. If you would like to make a GYT or STI testing appointment, you can do so on the Tulane patient portal or call the health center uptown at 504-865-5255.